Good morning, everybody. I'm Angela Touhill. I'm one of the nurse practitioners here at Hunterdon Cardiovascular. Welcome to my lecture on how to keep your heart healthy. We're going to divide this into two sections. One, a little bit of education about some heart topics so that you can learn some things. And the second part into how to not see me in the office because you're going to be so healthy you won't need to come. Okay, so first of all, a little education for you all. Hopefully you guys never have any of these troubles. But these are the top three things that I see in my practice. Coronary artery disease, which is the blockages in the blood vessels of the heart that cause heart attacks. High blood pressure, probably we're all more at risk of having high blood pressure. And atrial fibrillation, which is an arrhythmia or an irregular heartbeat that a lot of people have. About 30% of people over the age of 80 have this. So this is another thing that you should probably know about. So we'll start with coronary artery disease. This is a fancy way of saying blockages. Your heart's a muscle, and it has blood vessels that bring blood to it. Just like the rest of the muscles in your body need to be supplied with blood, so does the heart muscle. And when blockages occur and your heart doesn't get enough blood to it, and thus not enough oxygen, that's what causes a heart attack. Now, there are many risk factors for coronary artery disease, which are the blockages that cause heart attacks. Family history of premature coronary artery disease, meaning if your first-degree relative, which is your mom or your sister, was younger than the age of 65, or your dad or your brother younger than the age of 55, if they had a blockage or a heart attack, that is a risk factor for you personally. If you have high cholesterol, that's a risk factor. The guidelines for what's high cholesterol have changed over the last couple of months, so everything's a little bit different. But if your doctor or nurse practitioner says you have high cholesterol, that's a risk factor. High blood pressure. Again, there's different guidelines for what's high blood pressure nowadays, but if you have high blood pressure, that's another risk factor for developing blockages. Smoking. Everybody who smokes, they say they're worried about emphysema or lung cancer, but it is a huge risk factor for developing blockages. I have people who have heart attacks, who need stents, who have bypass under the age of 50 even, and it's all because of the smoking that they do. And lastly, diabetes. So if you're going to try to avoid having heart attacks, if you're going to try to avoid having blockages, you need to look at your life, see if you have any of these risk factors. The more risk factors you have, the worse it is for you. Some of these things you can help, some of these things you can't help. You can't help if your mother had a heart attack when she was 50 years old, but you can help it whether you smoke. You can help whether you have high blood pressure or not by getting rid of it, and we'll get to that in a second. You can help if you have high cholesterol or not by the things that you eat and your weight and the amount of exercise you do, and if you need medicines, taking medicines. Diabetes, sometimes you can help a little bit. You can help diabetes by, you can help to get rid of diabetes or not to get it by staying the proper weight, by eating nutritiously, by exercise. The way we treat coronary artery disease, or the way we treat the blockages that can cause heart attacks, there's many things we do. Again, the most important thing is getting rid of your risk factors. So looking at that list I just showed you, seeing what you've got, seeing what you can get rid of. Secondly, by taking medications. If we know you have blockages, there's several medications that we give you, including aspirin, statin medications, and other types of medications that help to make the blockages grow slower or not cause heart attacks. If the blockages are severe, and we diagnose this on a cardiac catheterization, which is when we go into the heart blood vessels via the arteries in the arm or in the leg, and see if you actually have blockages. If we find that you have severe blockages, sometimes you need to have angioplasty and stenting. Sometimes you need to have bypass. The way we decide which one is best for you is by how bad the blockage is, how many blockages that you have, and where they're located within your heart. So if you have a small blockage or a medium blockage that we find, we treat you with medications and modifying your risk factors. If we find that you have large blockages and there's only one blockage, let's say, in a good spot, then maybe you can have angioplasty, which is smushing the blockage out of the way, and stenting, which is the stent is like a scaffolding or a piece of screening that prevents the blockage from reaccumulating. If you have multiple blockages, and if they're in bad spots of your heart where perhaps two blood vessels bifurcate or branch off from one another, then you might need to have bypass. So it's not quite as it's not very cut and dried. It's not a recipe book when you have a blockage as to how we fix it. But these are some of the options that we have for treating coronary artery disease and preventing heart attacks. High blood pressure. This is something that a lot of people have. These are some of the, this is the definition of high blood pressure. If the top number of your blood pressure, which we call the systolic blood pressure, is greater consistently than 130 to 140, and what that means is just because your blood pressure is high one time does not mean you have high blood pressure. It has to be consistently elevated over a period of time. If you just saw a car accident and you're scared to death, or you just were in a car accident, your blood pressure is going to be high. It doesn't mean you have high blood pressure as a problem, so it needs to be diagnosed on 2 or more separate occasions. Another way to get high blood pressure is if the bottom number is high. We call this the diastolic blood pressure. So the top number is the systolic, and the bottom number is the diastolic. And if the bottom number is greater than 90, that's another flavor of high blood pressure. In case you wanted to know, you may not want to know, but in case you wanted to know, the way you have 2 numbers in your blood pressure is the top number is the pressure in the blood vessels, the arteries of the body, while your heart is beating. The diastolic, or the bottom number, is the pressure in those blood vessels in between heartbeats. Did anybody want to know that? Yes? Good, good. Okay. You want to check your blood pressure when you've been resting and seated for at least 5 minutes. If you've just run around the room 5 times and then check your blood pressure is going to be high, and you're giving yourself a false sense of high blood pressure. So you need to sit, rest, read a book, don't pay bills, don't talk on the phone to the bill collectors, none of that while you're having your blood pressure taken. Sit and rest, watch TV, read a book, look around, then have your blood pressure checked. Note to self, blood pressure machines at home are notoriously inaccurate. Even if you just buy them, it does not mean that they work. About 1/3 of them seem to not work properly. So number 1, if you buy a blood pressure machine, save the receipt. Bring it to your doctor's office to be checked for accuracy. So what happens if someone brings their blood pressure machine to me, I check it myself with my ears and my stethoscope because that's the most accurate way. And then 1 minute later, I check their machine. You can't check it at the office and then go home and check it. That's, time has passed, you've been walking around, you've been driving the car in stressful traffic. So that's not a way to correlate whether your machine's accurate. You've got to bring it in and have them checked, within a minute of each other. Okay, risk factors for having high blood pressure. Some of these are obvious, but here we go. Obesity. The more that you are above your ideal weight, the higher your blood pressure is going to be. This is good and bad because one of the ways that we treat high blood pressure is if you need to lose weight, that'll bring your blood pressure down. So that's something I'm actually glad when people are overweight and have high blood pressure because there's treatments that we can do without medications. If you lower your weight, your blood pressure will go down. By the same token, if you have normal blood pressure and you're a normal weight and all of a sudden you lose 20 pounds because you've been on some crazy diet, your blood pressure can go dangerously low. So excessive weight will raise your blood pressure. Weight loss will lower your blood pressure. Second risk factor, sedentary lifestyle. People who sit and do nothing, their blood pressure will be higher. People who exercise, their blood pressure will go up during exercise, but in general, their blood pressure will be lower. So again, you don't want to check your blood pressure during exercise or after, it'll be high. But in general, if you exercise, a couple hours after you exercise, your blood pressure will be better than when it started. Next risk factor for high blood pressure, excessive calorie intake. If you're eating too much, your blood pressure will go up. It doesn't matter if you're the proper weight or not. If someone's the proper weight and goes and has a huge Thanksgiving meal, their blood pressure will be higher for that time period. So even if you're the proper weight, eating too much will make your blood pressure higher. Excessive caffeine intake. Now, I love coffee. I'm not giving up coffee. I may actually have too much coffee, but too much coffee raises your blood pressure, not good. So a cup or 2 of coffee or tea a day should probably be okay for most people. But if you're having a pot of coffee or 3 monster things from Dunkin' Donuts a day, probably too much coffee will raise your blood pressure. Excessive salt or sodium intake. Sodium is the medical word or the nutritional word for salt. Salt is in everything you eat. It's going to be more in processed foods and foods that are prepared in restaurants or fast food places than in the food that you cook at home. So it's all about choices. If you're having fruits and vegetables, if you're having lean cuts of meat, if you're doing most of your cooking at home, you're not adding salt, that's great. But if you're eating out and you're eating cold cuts on your sandwich every day and you're saying, oh, well, I don't add salt to it, that's not a low salt diet. In general, we all should be on 2,000 milligrams of sodium a day, which is very difficult. For fun, now this is a strange way of having fun, but if for fun sometime, if you want to keep a little food diary for a day, look at all the labels and all the things you eat and write down how many milligrams of sodium or salt are in the foods that you're eating. Bearing in mind that when you look at the labels, the amount of sodium listed is for a portion, and frequently a package of something, it may say, like a can of soup, it has 2 portions in there. I could have 3 cans of soup myself. So you have to do some multiplication in there. And that will it'll make you aware of which foods that you're eating have more salt than you really need to be eating. So again, the things that are going to be high in salt, not only the salt shaker, processed foods, cold cuts, hot dogs, chips and pickles, restaurant food, takeout, and frozen meals. Frozen meals this has come to my awareness more recently. If you look at the back of the frozen meals, even ones that are proposed to be healthy choice or whatnot, they may be low in calories, low in fat, but they're not low in salt. That's why they taste okay, is because there's so much salt in them. So for fun, add up all the salt that you're eating in a day, and you may find that you're eating a little more salt than you ought to, and that will increase your blood pressure. Okay, getting older. Every year that you get older, over 50, your blood pressure is going to get a little higher and a little higher. Your blood vessels, which are very elastic, nice little guys, they tend to get more stiff and calcified as one gets older. So unfortunately, as one gets older, one's blood pressure may start to get higher. That's something you can't help. But that's why more older people are on blood pressure meds than teenagers. Okay. Pain. Pain can make your blood pressure go up. If somebody cuts your arm, your blood pressure is going to go up. That's a transient thing. That's not a permanent blood pressure problem. But if you have a chronic pain condition, chronic low back pain, chronic arthritis, any type of a chronic pain, that's going to raise your blood pressure as well. On one hand, if the pain is short-lived, you don't want to have your high blood pressure treated for high blood pressure that's been caused by pain. However, if you have chronic pain and it's a chronic condition, that's going to be, you might as well treat your blood pressure elevation that's caused by that, because that's not going away. Stress. Stress can raise your blood pressure. As you can imagine, if you're in a spa relaxing, you're going to have a nice, low, relaxed blood pressure. But if you're driving in traffic, your blood pressure is going to be high. So some people have transient stress that comes here and there. That happens to all of us. But someone whose life is stressful in general, that may add to the elevation of your blood pressure. Make sense, everybody? Good. Treatment of hypertension. It's very basic. There's medications and there's modification of risk factors. We just went over the risk factors. You look at your life, which one of those do I have? How can I make that go away? If you have a sedentary lifestyle, you have to start exercising. If you have too much weight, you've got to lose it. These are ways to not use medications, but to lower your blood pressure. It doesn't hurt if you have some of those risk factors already to start modifying them even before you get high blood pressure to prevent the high blood pressure from coming. That would be a good idea. And then we also have many medications that we use to treat blood pressure. We make the decision to treat the blood pressure, we make the decision to start medications when we know the blood pressure has consistently been elevated, if we see signs of damage to the heart or to any other part of the body from having had high blood pressure too long. And we try to choose our medications so we sort of get 2 for the price of 1. There's many blood pressure medications that don't just lower blood pressure. Some medications protect the kidneys from damage from diabetes and lower blood pressure. There's medications that lower blood pressure and suppress skipped heartbeats. We try to choose a blood pressure that gives you 2 benefits for the price of 1 pill type of a thing. So it's all very individually catered to the person who's coming in with high blood pressure. No one wants to take pills, I don't think. When someone comes to me and they have high blood pressure, and they definitely have it, they've had it for 2 or more occasions that I've seen them, and we're making the decision to start to treat them, no one wants pills. I make deals with people. You don't want pills? Fine. You have 4 months. Look at your risk factors, which I'll do with them. Modify them. Start the exercise. Start the heart-healthy diet. Lose a little bit of weight, and let's see where you are. Usually if people have significant risk factors and they can modify them, maybe we can get away with not using medications. I also make these deals that people who are on blood pressure medications, I'll say, if you lose 20 pounds, I bet you I can get rid of a pill. So the medications are important, but the hard work which the person who has the high blood pressure has to do, that's just as equally important. And that's my story on blood pressure. Good? Okay, now this is more for fun. Lots of people have AFib. This will allow you to talk to people, to bring up a topic at dinner parties when there's a lull in the conversation, some obscure topic, and you can talk intelligently about it now. Okay, atrial fibrillation, or AFib, is an irregular heartbeat. In general, we all have a nice regular heartbeat. We all are born with a pacemaker in our heart. We're born with it, and it makes your heart beat nice and regularly. Right now, everybody's heartbeats are about like 60. They're all relaxed. If you're running around, your heartbeat might be like 70 or 80 or 90. And if you're really running around, maybe it's 130. But in atrial fibrillation, that pacemaker that we're born with is not running the show. We have a whole bunch of little electrical guys in the top chambers of our heart that are causing the top chambers to squiggle and the bottom chambers to go irregular and sometimes very fast. Sometimes people who have AFib could be dizzy. They may be out of breath. They may have chest pain. They may have fatigue. Some people feel something's wrong right away if they have this bad heart rhythm. Some people have no idea. Sometimes when people have AFib, they're at higher risk of stroke. The top chambers of the heart are just squiggling. They're not fully squeezing, so the blood can stagnate in the top chambers of the heart and then cause strokes. So sometimes people who have AFib, we put on blood thinners to prevent this from happening. Risk factors, because again, you don't want to be told you have AFib, so it's best to prevent it by modifying your risk factors. Obesity increases your risk of having AFib. Sleep apnea. Do we all know what sleep apnea is? No. Sleep apnea is when you stop breathing while you're sleeping for like 20 seconds at a time. So the typical thing is you're snoring and snoring. The person, your husband's laying there in bed and listening to you snore, and all of a sudden it's peaceful and quiet. Ah. And all of a sudden there's a huge snore and you start snoring again. So sleep apnea frequently is occurring in people who snore. So if you snore and somebody has said, oh, you stop breathing while you sleep, that's a time to go talk to your doctor about sleep apnea. So sleep apnea can cause atrial fibrillation. I'm a huge, not big fan of sleep apnea that's untreated. If your thyroid's out of order, this can cause AFib. If you have problems with your heart valves, that can cause AFib. And if you have excessive alcohol intake, sometimes this can cause AFib. Even teenagers, this is something that occasionally happens to college students. They go to the emergency room, their heart's beating fast, and they're in AFib because they just were drinking excessive amounts of alcohol the night before. So this can happen in teenagers, but it also can happen in grown-ups too. Okay, so that's just a brief overview of AFib. Everybody's eyes hopefully are not glazed over. Whatever. Try not to get it by not getting these risk factors, modifying these risk factors. Again, I don't know if you want to know these things about the AFib. The way we treat the AFib, we decide whether you need to have your blood thinned. If your heart's going too fast, we try to slow it down. We look for underlying causes or risk factors that could have precipitated this. And sometimes we try to get the heart back into normal rhythm. Sometimes we can't, and so we keep the people in the AFib. Sometimes we try to get them out. Does that make sense? Yes? In the back, everybody? Good. Okay, so that was the cardiology in a nutshell section of this talk. So you learned about blockages in the blood vessels of the heart and the risk factors for the risk factors that can cause you to have these. We learned about high blood pressure and the risk factors that can increase your risk of having high blood pressure. And we learned for fun about AFib so we can talk about it to people at dinner parties. Okay, prevention. This is the second part of my talk, and it's called How Not to See Me in the Office or in the Hospital, because you don't want to do that. You want to be in good health. I tried to do this in order of importance, but they're all kind of important. for now, this is the most important, regular cardiovascular exercise. There are so many benefits to exercise. It lowers blood pressure. It lowers cholesterol. It helps with weight loss. It boosts your mood. After you exercise, it's such a pain to exercise. I hate it, but you're so proud of yourself. You're in a good mood all day. And you look better. You help to tone and so forth. Now, it's not just going to the gym and pumping iron. It's cardiovascular exercise. Sometimes there's people who are very, very strong. They have strong muscles. They can pump iron, but they have a huge tummy because they're not doing cardiovascular exercise. And I'm glad that they're not sitting watching TV, that they're pumping iron or going to the gym. But if you're not doing cardiovascular exercise, I'm not counting it. So if you're at the gym 3 days a week, let's say you're there for an hour each time, at least 30 minutes of that hour should be cardiovascular. If you want to pump iron as well, that's cool. And in fact, that's probably a good idea. But you've got to do the cardiovascular exercise. Okay, I already said 3 days a week, 30 minutes plus, whatever. But this is the other thing. If you're drenched in sweat and need a shower at the end, it's exercise. If you take a stroll with your friend and you're chatting the whole time, that's, again, better than sitting around watching TV, but it's not quite exercise. If you can talk to somebody and have a nice conversation while you take your walk, you need to do more than that. You should be drenched in sweat and need a shower at the end, then it's exercise. Unless you're swimming, that's a different story. So, I mean, everybody knows what cardiovascular exercise is. The usual things are walking briskly, jogging, riding a bicycle, swimming. Now they have these elliptical machines, which I think when I'm on them, I look very awkward, but many people love them. And it's a good way to get your heart beating fast and to sweat. They have other things, recumbent bike. People, it's easy to find excuses not to exercise. Me, I don't like it. That's my excuse. I don't have a babysitter to watch my kids when I go to the gym. There's a million excuses. They are sometimes legitimate, but your body's not going to care if you have a good reason or not. You still have to do it. So for example, many people have orthopedic troubles. They have bad backs. They have bad knees. There's an answer to all of that. Swimming is very easy on your joints. So if you have arthritis, you have bad knees, swimming is easy on those joints. You don't even have to swim. You can tread water. You can do water aerobics so your feet never leave the ground if you don't know how to swim. I've had patients who just walk back and forth in the pool with the resistance of the water against them. I'll take it. That's something. Your heart's getting faster. You're moving around. The other thing about swimming is that you don't get hot. Another thing that for people who may be older or have bad backs or bad knees is you can even do armchair exercise. This has been my new kick this winter with some of my older ladies who can't move around that much and who are bound in the house because of the bad weather. They watch a TV show for an hour a day, some TV show that's on every day. They sit and watch the TV. During the commercials, they get soup cans or weights, and they stand up and march in place and take their soup cans and do arm exercises. So the commercials last about 3 minutes. They're boring anyway, and then you get to sit down and watch the rest of your show. And then the commercials come again. They're up. It's doing something. I know it's not like running a marathon, but you can find a way in your life, unless you're paralyzed from the neck down, to exercise. Okay, enough of that. Not quite. One more point. Some people are afraid, if I exercise, I may have a heart attack, something like that, which I don't buy. If you never exercise, if you're sedentary, you're at a desk job, you watch TV, you're not exercising. Let's say you go for a walk with your neighbor and you're walking briskly uphill and down and you're out of breath. You don't know if you're out of breath because you're out of shape or if you actually have a heart problem that's making you out of breath. Whereas the person who exercises regularly, they know how they feel when they exercise. They may be a little winded, a little tired, but they know how they feel when they're exercising. Then if there's a change in how they feel, then they know they might have a heart problem and they can seek medical attention. So for example, if you're used to walking 3 miles very briskly, you're sweaty and you're a little out of breath, but you can do it, and you do this 3 times a week for a couple of years, and all of a sudden you're walking half a mile and your chest is hurting and you're out of breath and you know something's wrong. It's not deconditioning, you know something might be wrong, and then maybe you can go seek medical attention and halt trouble before it starts. Does that make sense? Good. Okay, so we talked about exercise, a way to stay away from seeing me in the office. Secondly is eating a nutritious, heart-healthy, low salt, low cholesterol, low fat kind of a diet. But these are just some of my little tips. Reduced processed food. Home cooking, make it yourself. All the processed food has salt, extra fat, not worth it. It's convenient, but not worth it. Portion control. I went out to dinner last night and had what I thought was quite a healthy meal. Salmon, some mashed potatoes, maybe not so healthy, and all these nice vegetables. But it was a huge portion, and I was full after half of it, but it was so tasty I kept eating it. And that wasn't the right thing to do. I could have brought it home. It'd be better to leave it on the plate and waste it than take in more calories than I need. So portion control, even of fairly nutritious food, is important. Moderation in alcohol. Alcohol has calories. So, a glass of red wine, a couple of glasses of red wine, fine. But in everything in moderation. If you're having 4 glasses of wine, forget the alcoholic part, that's 800 calories. You don't need 800 calories added to what you've already eaten that day. These are my pet peeves or my pet little Heloise's hints here. Don't have calories in your beverages. Soda, fruit juice, there's so many good foods to eat. Why waste your calories of the day on liquids? If you want to have an orange juice, you should have an orange and a glass of water. The orange juice has sugar, some nutritional value, but not as much as having a piece of fruit. So forget the fruit juice, sodas. I'm a big fan of water. Anyway, limit sweets, simple sugars, and carbs. This is good for your heart. It's good for preventing diabetes. So this means if you're going to have a sandwich, pick, instead of white bread with 3 pieces, have something that has wheat bread, but 3 grams of fiber or more per serving for your bread. That's going to be a healthier choice. More complex carbs, better for you. And of course, we all know eating too much sweets isn't good. Your mother said that. I don't have to say that. This is another tip that works for some people. Eat 18 out of your 21 meals a week in a healthy manner. 7 days a week, 3 meals a day. Pick 3 meals that you can splurge on. Have a Taylor ham, egg, and cheese on a Sunday morning, but then have your oatmeal the other days. So that's another tip that works for people. And then my last tip that works for me, if you have a smartphone, which many people do nowadays, MyFitnessPal, it's an app. Every time that I've been eating nutritiously, it's been because I'm using that app. It logs in. Try it out. Go look for it. I'm not going to explain it right now. Okay, so my final little tips. Maintain proper weight. I can't emphasize this enough. Excessive weight leads to so many health problems. It keeps me in business. Put me out of business, okay? Second helpful tip. I can't emphasize this enough. Smoking, again, forget lung cancer and emphysema. Smoking causes so many heart problems. Oh my gosh, don't do it. It's smelly, it's expensive, it makes blockages everywhere like you wouldn't believe. It makes blockages in your heart, in the blood vessels of your neck that can cause strokes, blockages in your legs so your legs hurt when you walk. There's no goodness to it. It's not cool. I'm sure no one here smokes, but anyway, there you go. And as I sort of alluded to before, last but not least, if you snore, get a sleep study. Untreated sleep apnea causes so many health problems, bad heart rhythms like the Afib we spoke about, high blood pressure, strokes, high blood pressure in the lungs. So if you snore, and or you're overweight, and or if you're a girl, your neck measures 16 inches around, or if you're a man, 17 inches around, or if someone has ever told you stop breathing when you sleep, get a sleep study. And that is the end. Thank you very much.